Do you have nasal congestion? Have you been told that you have a deviated septum or turbinates that are enlarged? Have you been told that you can have a surgery performed to fix that condition easily without any other risks than risk for bleeding and infection? If so, you have been told a lie. These kind of surgeries are always damaging to your respiratory organs. And first of all, nasal congestions more or less always are related to inflammation in your body. It could be from allergy like IgA or IgE antibodies. Your body can develop such sensitivity to more or less everything. It could be like to eggs, it could be to peanuts, it could be to grass pollen. So you need to check that out first before deciding about surgery. And such reaction is quite easy to understand because you get that reaction quick in like 10-15 minutes after you eat something. So if you get nasal congestions within 5 to 10 minutes or 15 minutes after you had some food, it could be related to antibodies. Another thing that is a little bit more difficult to understand is if you have IgG food intolerances. So if you have IgG antibodies to certain foods, because that reaction can happen like much slower, up to I think it's 72 hours after you had some food. So you need to think, if you have some reaction, if you have a stuffy nose, you need to think back like a couple of days. What food did you have 2 days ago? So it's not easy, and that's the reason why I recommend people to do one IgG food intolerance test. So if you have nasal congestion, if you have inflammation in the body, autoimmune conditions, problems with your stomach, then I recommend people to do one IgG food intolerance test. Also, another thing is that some people, they lack DAO enzyme to break down histamine, and if you lack that enzyme, you can get nasal congestion easily. It could also be for women, it could be by upregulated hormone levels of the hormone estrogen. So if you have abnormal high levels of estrogen, then you can get nasal congestion. Pregnant women often get higher levels of estrogen, and that's why they often get nasal congestion as well. So yeah, there are quite a few reasons. It could be something in your environment as well, like mold or dust or dry air, or yeah. So you need to research this. But yeah, the problem is that this kind of surgery is not like other surgeries. It's not like a operation where you have a broken leg fixed. This surgery is always about destroying your respiratory organs, your breathing organs, in one or another way. It could be more or less, but it's always about destroying your breathing organs. And also a septoplasty. What the doctors don't tell you is that often the mucosa rifts, it tears apart, and it becomes super thin, and you lose airfeel. It becomes numb and non-functional and dry. And also septoplasty is more or less always combined with turbinate reduction, where they remove at least 2 or 3 centimeters of the inferior turbinates. And most of the times they don't tell this to patients. So in my case, for example, I signed up for a septoplasty. They never said something about removing or destroying my turbinates. But after the surgery, I got terrible problems with my sleep and with the mucosal membrane. I was extremely dry in the nose, and when I did an X-ray a few years back, I discovered that more or less all of my inferior turbinates was totally removed. And this is something that's common. I heard so many people saying the same. They signed up for a septoplasty, but ended up with a septoplasty plus a turbinate reduction, the total removal of the inferior turbinates, or reduction of the first few centimeters. So in my case, I only have the tail remaining, like 1.5–2 centimeters maximum, and the mucosa that's left there is extremely scarred and non-functional. So yeah, after I got my damage, I have done a few thousand hours of research, and this research I want to share with you in this video. I have no reasons to record this. I have no reasons to stop people from having nasal surgery. I don't earn any money on this channel. The only reason why I do it because I want to stop this madness. I want to stop more people from having damage, because if you have damage to your septal or your septal mucosa or your turbinates, it's irreversible. You can't really do anything about it. So it's the most important part is to understand what you risk before the surgery, and to choose a natural way to treat your nasal congestion with a diet change instead. So here's, if you look over here, it's an index. So this video is going to be quite long. So if you want to find some certain parts that you are more interested in, you can just look on the index here. In the end of this video, there are some voices from people who got the damage, so you can hear and listen to what they say to understand their suffer and what you are risking. Also, I want to say that I did a longer YouTube video where I explain more in detail about everything that can happen when you have a septoplasty or turbinate reduction performed. It's a 2.5 hour long lecture where I explain the science and the research about empty nose syndrome and the breathing. So if you want to have the total understanding of this condition, you can look on that one as well. But yeah, let's start to talk first a little bit about turbinates, what they are, how they look, and what functions they have. So here is an image where you can see the turbinates from the side. There are 3 turbinates in each nostril. You have the inferior turbinate down here. In an adult male, it's most of the time around 5 to 6 centimeters long. And then you have the middle turbinate up here, and you have the superior turbinate up here. That's a really small one. This is another image showing the same thing. So down here the inferior turbinate, and up here the middle turbinate. And this is how they look from the front. So it's a bone structure that grows out from the maxillary sinus wall, and it's covered by thick mucosa and blood vessels. So one important thing you need to know about that the healthcare providers will not tell you about is that your turbinates and the receptors, the nerve endings in the nose, they are all connected to your brain and to your nervous system. So if you destroy the mucosa in the nose, if you remove the turbinates, if you destroy the septal mucosa via septoplasty, for example, if you destroy the septal swell body, it's also called the 4th turbinate of the nose. If you destroy those organs, you will have one direct effect on your nervous system and on your brain. So in many cases, and in my case for example, this have caused me tremendous sleeping problems. I wake up like after 2-3 hours of sleep. I sleep with a sleeping pill, so those 2-3 hours are not good quality sleep. So after 3 hours I wake up, because in my case I have one functional nostril where I still have some airflow sensation. I still have the nerve connection between the nose and the brain. So I can feel that I'm breathing in this nostril. But you also have a nasal cycle that congests one side and decongests the other side. And that shifts back and forward, like everything from 20 minutes to 3-4 hours. So I use decongestion spray in my good left nostril to force that one to stay open. After 3 hours, I wake up. Then I have congestion in my good left nostril. I'm now breathing through only my bad right nostril, where I have absolutely zero air feel. So the nerve connection between this nostril, the mucosa here, and the brain is totally damaged. It's gone. And that's because the surgeon removed my inferior turbinates, and it's also because he destroyed my septal mucosa when he did a septoplasty on me. And during that process he also destroyed the fourth turbinate, the area that's called the septal swell body. So when I wake up at night, it's always when my good left nostril with airfeel is blocked, and when I'm instead breathing only through my bad right nostril. I never wake up if I'm breathing through my left nostril. Never, ever. So each time this happens, I wake up gasping for air. I have a strong sensation of distress in my body. My breathing is a little bit too fast. Not hyperventilation now, but a little bit too fast, a little bit too shallow. So too many breaths per minute to be relaxing. I also have no air feel, like I said, and that triggers a sensation of air hunger. I breathe, I inhale, but I don't feel satisfied with the breathing at all. Some people describe this like suffocation, some people describe it like paradoxical obstruction. And if you haven't experienced this, it's quite similar to the sensation in the body, to the feeling you have in the body when you are completely blocked in your nose when you have a cold and you breathe through your mouth. You know how distressing that is. You can't relax really, it's hard to sleep, you feel not good at all. So that's the feeling I'm waking up with. And I also have that feeling each time my nasal cycle shifts from the good side to the bad side. So this could be also during the day. It could be for several hours. Last day, this side was completely blocked for the whole day. And I have been using so much decongestion spray now, so the good nostril, it can't open up anymore. It's so sensitive now. Mucosa is so irritated, so it won't open up. So I'm having this distress for several hours each day. And as soon as my left nostril opens up, I feel relaxed again. And if that happens during night, it's first then I can fall asleep again. So let's talk a little bit about the function of the turbinates. First, I can say that on the surface of the turbinate there are goblet cells that produce mucus, and that mucus contains antibacterial substances like lactoferrin, IgG antibodies, and lysozyme. And these substances keep the mucosa out of infection and protect the mucosa from wear and tear by a constant breathing that otherwise would dry out the mucosa and damage it. That's one thing. Another thing is that there are some small hairs. I think it's in English called cilia or something, cilla. Those hairs are at the surface of the turbinates, and those do some rhythmical movements that transport particle, viruses, bacteria back to the back part of the nose, where you will swallow it down and it will become neutralized by the stomach acid. Another thing is that on the surface of the turbinates there are several kind of receptors. The receptor I'm talking about here now is the TRPM8 receptor, the thermoreceptor. That's the receptor that is active when you feel a cool sensation, a cool feeling when you inhale through your nose. So, and that's not for nothing. That nerve signal to the brain is really important, and it activates the sympathetic, the parasympathetic nervous system. It activates that and put that one in dominance. So a person who has that part of the nervous system in dominance, he or she is relaxed and feel good. So when these signals are lost, if we remove the turbinate, if we get secondary damage from dryness in the nose, years after that the turbinates are removed, the remaining receptors and the regional receptors would be gone or damaged. So that means that the brain will not get the signal that we are breathing, and that's something that activates the limbic system, and that's the explanation why people with empty nose syndrome feel terribly bad, have high stress levels and can't sleep. So those thermoreceptors, they have a function. They are not just there for fun, and they are connected to your brain and to your nervous system. The turbinates also act to heat, humidify and filter the air before it reaches the lungs. Moist air with high relative humidity is something that is important for a correct gas exchange in the lungs. And the filtration of the particles and bacteria, of course, also protects the lungs from damage and infection. Also, when you exhale through your nose, the air that has been already in your lungs is now moist. It has a lot of water, a high humidity, and when that air reaches the turbinates again on the way out, it is transformed into water again, and the capillaries, the small blood vessels within the turbinate, they reabsorb the water. So this process means that the body saves water while keeping the mucous membrane moist and healthy at the same time. The turbinates via the nasal cycle also regulates the airflow and to the body, to the lungs. So hypothalamus is the part in the brain that regulates the nasal cycle and the blood flow to the turbinates based on desired needs. So when we are active, the body needs more oxygen. This is felt by hypothalamus, and a nerve signal is sent to the turbinates to deflate. So this allows more air to pass to the lungs, and the body can get more oxygen. And when the activity is interrupted and we are supposed to calm down, a nerve signal is then sent to the turbinates again from the hypothalamus. These nerve signals tell the turbinates to shrink down, to swell up. This nerve signal tells the turbinates to swell up again to increase air resistance. And an increased air resistance leads to slower, deeper breathing with fewer breaths per minute. Something that leads to a relaxation state. It's also, according to some scientific studies I have researched about, increases the person's cognitive ability. So it increases the function of the brain. And if the turbinates are destroyed, the nose will always become wide open, and this function will be lost. The person then will find it more difficult to relax after being active. So let's talk about another point here. The nasal cycle, I've been talking about that a little bit before. It's a shift between left to right nostril being alternately open or closed. So left nostril opens up, right nostril closes, and it changes from time to time. So the nasal cycle ensures that each nostril rests in respiratory shifts while keeping total air resistance constant for a relaxed breathing. This protects against mucosal dehydration, mucosal damage, and mucosal infection. And during the active part of the nasal cycle, mucus is also secreted more, and that mucus contains antibacterial and antiviral substances. So it's also important for the immune function of the nose. Furthermore, the nasal cycle and the function that one nostril is always a little bit more open than the other is something that improves your sense of smell, because more scent particles can then reach the upper part of the nose where the sense of smell is located. The turbinates also reduce the open volume in the nose, which leads to a compression of the air and acceleration of the airflow. And this is important because high velocity along the nasal mucosa leads to thermoreceptors on the surface of the mucosa being activated, whereupon the individual is given the ability to feel that they are breathing through the nose. If this nerve information is missing, the limbic system in the brain is activated, and the individual is caught in a fight and flight response. And lastly, the turbinates and their shape, they distribute the airflow in the nose so that it spreads evenly over the entire mucous membrane of the nose. This increases the ability to humidify and heat the air, while at the same time it stimulates the nerve endings receptors all over the mucosa in the nose. When the receptors are stimulated, a signal is sent to the brain via the fifth cranial nerve that tells the brain that we are breathing. The person then experiences a cool sensation in the nose and a pleasant sensation of relaxed breathing. So if the turbinates are removed, the air is not distributed along the entire mucous membrane, but only goes along the nasal floor. And this leads to a reduced ability to feel the airflow in the nose, and that's something that causes distress also among the individuals. And also one more thing, I haven't wrote that here, but the diaphragm is a muscle that under your lungs that contracts your lungs, so it works like it regulates the breathing. It makes you be able to inhale. That muscle also needs a certain air resistance, a certain resistance. So if you remove your turbinates, your breathing will become shallow, rapid. You will not get the natural resistance that you need in the nose. So that's also an important factor about the function of the turbinates. So one thing you should also know about is that the damage you get from nose surgery to a turbinates might not come up until several years after the surgery. It's quite common that the problems start mainly like 2, 3, 4, 5 years after the surgery. In my case, I had sleep problems directly after the surgery. And I had dryness, but the dryness wasn't too bad in the beginning. It became worse every year, and that damaged the mucosa more and more every year. Eventually, I had an MRSA infection, I think it was, 4 years after my surgery. And the few remaining receptors, the few remaining thermoreceptors I had in the nose were destroyed during that infection. So I totally lost my air feel in the right nostril. And I also became extremely much drier after that infection. So you can have the surgery, you can feel fine for a few years, and you can have the problems later. And this is because you start with a healthy mucous membrane. And if you remove the turbinates, your nose will become open all the time. You will lose all these secretions with antibacterial substances that will protect the nose from inflammation. The mucus will also protect the mucosa from damage from dryness. So it's likely that when your nose is always open, you will get damage from dryness. And your nasal cycle is also damaged, so this means that one side of the nose can never completely close. So yeah, everything inside there is completely open. It's like leaving the door open to your house. So eventually this will cause some degeneration of the mucosa, and yeah, you can have problems first after a few years. And this is also one reason why the doctors don't really know about this condition. They don't really talk about it because they see the patients like a half year maybe after the surgery, and then never again. So what happens to the patients like 5-10 years later, they have no clue. And if the patients come back to see a doctor, they are not going to draw the conclusion that the problems in the nose is related to the surgery. So let's talk a little bit about the different methods there are to perform surgery to the turbinates. The first one, the least invasive one, I would say, but it depends on, it could be extremely
damaging to the turbinates depending on how the surgeon use it. But if they use it with care, this method could be the least invasive, the least damaging one. So the name of the method is radiofrequency, and it consists of it's a stick-shaped instrument. You insert that into the inferior turbinate or into the middle turbinate, and you heat it up. I don't know exactly to how many degrees you heat it up to, but you actually you fry the turbinate from within. And the reason why they do this is because they want the inner blood vessels to become destroyed, so that turbinate cannot swell up that much anymore. The problem is that if you burn too close to the surface here on the turbinate, on the surface here you have all the functional cells, so the nerve endings, the thermoreceptors, other nerve endings, other receptors. You have the goblet cells that produce mucus. You have the tiny hairs that transport mucus and particles and dust and everything backwards through the throat, where you can swallow it down and neutralize it in the stomach. So if you burn too close to the surface, you will destroy everything there, all the functions. So yeah, you will get only scar tissue. So you will lose the airfield. The mucosa will not be able to produce mucus anymore. And also, of course, you will damage more or less or totally the blood vessels within the turbinate. It can become more dry from that as well, and your nose will become open, so your body cannot regulate the airflow to via increasing the size or decreasing the size of the turbinate. So you will always have an open nose, and that's not good for the breathing. It's not good for the mucosal membrane. And the problem also with this method is that you don't know how the surgeon thinks who use it. Is he going to insert one point here and burn, another point here, another point here? Is he going to do it one time, two times, three times? How close is he going to the surface? So you never know that, and you only know afterwards if you got damage from it or not. And also another problem is that people do this and they do not feel better. So they come back and they say to the doctor, okay, it feels like I'm still congested, I don't know, maybe I should burn another time. But the problem is maybe they have already destroyed the thermoreceptors on the surface of the mucosa. So now they have paradoxical obstruction. They think that they are having nasal congestion, but they don't. They get air, but they just can't feel the air. So they burn one time again. Maybe they come back even another time. So I have seen several patients who have got their entire inferior turbinate totally destroyed by this method. So yeah, it depends on if you are lucky, you find a surgeon who are careful and only burn maybe 2 locations, and that's it, no more. And if you do it in the center of the turbinate, maybe this could be a method that works. But it's a risk. It's a risk of dryness, degradation of the mucosal membrane, infection, and of course the lack of airflow feel, and empty nose syndrome from that. So another method is coblation electrocautery. This method is more or less similar, or the exact, it's not exact same method, but it's very similar to radiofrequency. You insert a stick and you can see there are, I think, 3 lines on the stick. So you insert it until the 3rd line and you push some button or something and you heat it up. So you burn the tissue a few seconds and then you remove it, pull it out until the second part, and then you burn once again a few seconds more, and then you do that like 2 or 3 times. The problem with this method is that it has even higher temperature, so it can destroy even more of the tissue within the turbinate and also on the surface. So yeah, I'm not going to say so much more. Everything matters that I was saying before about the radiofrequency method with this method as well. I have another method here. I don't know if this one is performed so much here in Sweden. I haven't heard about it really, but I know it's performed in the States a bit. The method is called, it's a microdebrider. I don't know exactly what the method is called, but they use an instrument they call a microdebrider. And it's a stick with a hole inside, and within that hole there's a knife. So you insert that stick into the turbinate and the knife rotates and it tears apart the mucosa from within, so you destroy those blood vessels. In theory, if the surgeon is careful and insert the stick just in a straight line like this here, this method could be a good option because it won't destroy the surface of the turbinate. Of course, there are nerves and everything in here, and there are blood vessels that go to the surface, so it could affect the surface as well, of course. But I think it should be a smaller risk than the radiofrequency and coblation method. The problem again is with the surgeon. You don't know, since you are not awake. You have no idea what the surgeon are doing, because if he starts to move around the stick like this in many directions, he could like destroy the whole inferior of the turbinate. And I have seen many images of people who is more or less, is no blood vessels within the turbinate anymore. It's just a hanging skin, hanging mucosa on the bone. And of course that will destroy the breathing. And yeah, so that's the risk with this method. Let's continue to talk about lateralization of the inferior turbinate. So this is a method where you break the bone structure of the inferior turbinate and you re-angles the turbinate. So in most of the cases you move it towards the lateral wall, so the wall next to your maxillary sinus. So there will be more open volume between the inferior turbinate and the septum. That allow more airflow. I think in theory I don't say if any method is good really. I don't think you should have no surgery. You should fix your nasal congestion by dietary things. To change your diet, to remove foods that trigger inflammation. Yeah. But if you choose to have a surgery, I think this is the best and safest method. And if I would have done surgery from the start, I would have chosen this method, but I didn't know about it. So what can happen? I know one negative part with this procedure is that if you move the turbinate inwards, the wall like this, of course there will be no airflow here. So these thermoreceptors that are located here, they will not be activated. So the person will probably get less airflow. And I have been listening to patients who had this method performed, and some of them say that I have less airflow sensation here. But I don't think it should be that big problem, because you have so much more thermoreceptors here on the outer part of the mucosa. You have in the septum as well. So I think it should be fine, but there is also a risk that there could be some nerves that tear when you put a lot of violence into breaking the bone here. Some blood vessels could tear as well. So, but I think it's considered like a quite safe method, and you can also probably in most cases, if you are not happy with the result, you can break the bone again and move it outwards. But of course, it's not going to be perfect like it was before. All right, let's continue with the last method here I'm going to talk about. This is cutting off the turbinates partly or totally with a surgical scissor, or with a, how to say, I don't find the English word, but with a knife, scalpel. So if we look on the image here, this is before the surgery. This is how it looks from the front in the nose. So if they remove the turbinates totally, this is how it looks. It becomes an empty hole here. This is not. These are actually my images. This is from below. You can see how the turbinates are here, and after the surgery it looks like that. So in my case, the surgeon saved the back part here. It's hard to say how long these are. It's not that long. The lower part is really short. It's like 1.5, maximum 2 centimeters. The upper part could be maybe a little bit longer, and that's why it tricks a little bit here in the image. So this is a really criminal method. It's an evil method, and I just can't understand how it's still performed. I did this surgery 2014. It's still performed 2022, and unfortunately it's still going to be performed 2030 or 2040. I don't think this will change, but it's so sad and so fucking annoying to see that the surgeons use this method. There's absolutely no reasons to remove the turbinates. I don't really need to explain everything that can happen, because I've been telling you a lot about this before. So it's a guarantee. It's an absolute guarantee that you will have severe problems for the rest of your life if you remove the whole turbinates and if you remove big parts of the turbinates with scissor. If we skip side here, you can see how it looks after. This is the upper part of the inferior turbinates. You can see here now it's a extremely open hole here. the air pressure is going to be low here, the air velocity is going to be low here. So if there are any remaining receptors here, they will not be activated like they should. And the airstream will go only along the nasal floor here. So everything up to the upper part of the nose will not get any airflow or extremely little volume of airflow. And eventually this part here, this part here is going to stand open. All the time is going to be open. Normally you have a turbinate here that could swell up, so it swells up and it blocks the whole nasal volume here. That means that it can heal itself if it has become dry or damaged from the constant breathing. It can heal itself. It produces mucus and everything, and in time this person is going to have a degeneration here. If there are any remaining functional thermoreceptors, they are going to be destroyed. It could take a year, it could take 4 years. Depends on what kind of conditions you live in. If you live in a humid environment, yeah, you can stay longer probably like that. But if you live in a dry environment, yeah, you're going to have problems really quick. It's another image in the middle here. You can see how open it is. Yeah, and this is X-ray images. You can see how open the nose is. So it's obvious that the airflow is going to be only along the nasal floor here, because the air works like water. Water always takes the easiest way. So all these functional receptors up here is not going to be activated. So yeah, it's one extremely stupid method, and if you only remove parts of the turbinates, it's still a really stupid method, because you will have a lot of scarring on the remaining parts, because you need to like remove the mucosa, remove the bone of the turbinate, and remove the tissue, and you're left with some free hanging mucosa, and they will have to cut some part of it, and they will have to try to fold it up and try to make it grow together and attach to the remaining stump of the inferior turbinate. So that one will be extremely scarred. I'm going to show you some images here in a second. Yeah, this is what I'm talking about. So this is my nose. I took those images myself. So you see the turbinate it should end here. So I lost all this part, and the remaining stump, this is cotton, by the way. I need to use cotton here to improve my air resistance. But yeah, the remaining stump here, you see, it's a non-functional mucosal membrane. All these white parts are scars. White parts here, a little bit brown color here. When you look at this big picture here, yeah, it should, your mucous membrane in the nose shouldn't look like this. This looks more like the skin under your foot. Same on this image here. So this means that even if they save the back part of the turbinate here, yeah, that part is not going to have any functional tiny hair, the cilia hair. It's not going to have any functional goblet cells. The thermoreceptor cells is not going to be there to function. This is more or less all scar tissue. So this will become numb. You will not be able to feel the airflow here. And this will cause you to have air hunger and suffocation and empty nose syndrome. So if I would only have this damage in that nostril, it would be better. But now I also have damage to my septal mucosa, so it's a double damage in that nostril. But yeah, this method, just don't do it. It's so fucking stupid. And yeah, you can see even here how bad the mucosa looks. Some like how to say, trenches, or it's not flat mucosa. So yeah, no matter what the surgeon say, don't do this method. And also you need to know, if you sign up for a septoplasty, that's what I did. I signed up only for a septoplasty. But years later, when I did my own X-ray, I discovered that the surgeon had removed also a big part of my inferior turbinates. And this is something they very often do. So if you sign up for a septoplasty, you are most likely get to have your inferior turbinates totally or at least partially removed by scissor or by scalpel. So let's quick talk a little bit about other kind of damage that you can receive from nose surgery. Damage that doctors won't mention to you. So it's unfortunately there are some pages here I haven't translated them to English, but this is adhesion, and if the surgeon don't put packing inside the nose after the surgery, the wounds can heal in a way so that for example the middle turbinate here can connect to the septum and to the lateral wall, and that could cause a lot of pain, and it's also a risk to fix that afterwards. Next injury that can happen is a septal perforation, and that can happen if the surgeon removes too much cartilage during a septoplasty. If he removes too much, there will become a hole, and that hole can become infected, and bacteria can enlarge the hole, and yeah, it's not easy to fix afterwards. You can try to put a plastic or a rubber button, but it won't be perfect. Another reason for septal perforation is also if the surgeon destroys the septal mucosa during the septoplasty. If he tears the mucosa, the cartilage within the septal wall will not get nutrition and blood supply. So in time that cartilage will die and a hole will appear, and that hole can become very large. Some complications you can have is disturbed airflow in the nose. You can get the whistling sound, the mucosa will become dry. You can get bleeding, you can get crusting, you can get the nasal obstruction, or at least it feels like nasal obstruction because you have destroyed the thermoreceptors, the nerve endings in the septal mucosa. And you can get a nasal collapse with an appearance change of the nose. I'll leave to you to read the rest yourself here. Another thing that can happen to you when you have partial or total turbinate reduction with scissor and scalpel is that you can have a hole into your sinuses, into your maxillary sinus. So the thing is that the surgeon, he cuts this part and removes the tissue, and he uses a tool like this one here, and he bends and break off some parts. And if he comes too close to the wall here, when he's going to remove the turbinate bone, he can easily, by accident, remove some parts of the wall here, and then you have a hole into your sinus, and that you can't do anything about that. In my case, this hole is quite small. I haven't been able to measure it really, but I would say it's probably not bigger than a 1.5 centimeters or something. But I think in some cases the entire wall is gone between the nasal cavity and the sinus. And of course that will cause you a lot of problems and you can't do anything about it. So this again is another reason to never ever have partial turbinate removal or reduction with scissor or scalpel. If the surgeon, in my case for example, had been using radiofrequency, this could never have happened, or the likelihood of it happening would be extremely small. So yeah, that method is so fucking stupid. And here we have some images of my nostril 4 years after the surgery. The damage you see here and the damage I'm going to explain is not directly from the surgery, but it's secondary to the surgery. So like I've been saying to you, if you remove the turbinates, you also destroy the immune system of the nose. The nose will always become open, and that will cause dryness, and that dryness eventually can cause inflammation, infection. So you see the white part here, that's not how a mucous membrane should look. This is either inflamed or infected, or there is some kind of degeneration, and during this time, and I still have problems with pain and discomfort in the nose when I breathe. It burns. It's a little bit better now, but it still burns, and during this time I had tremendous pain. It burns and I was extremely dry. The mucous membrane was bleeding. So that's a secondary damage, and the more you destroy on the turbinates, the bigger chance, the bigger risk there is that you will have this problem. And here is also another problem that can appear. So if you remove the turbinates within the green circle here, the inferior turbinates, there will be a jet stream of air flowing along the nasal floor, and that will hit the back part of the nose. It will cause dry throat. It will cause a lot of discomfort here, pain. It will cause a wound to appear, and eventually you'll have scarring, and that's what you see here. This is the back part in my nose, and the white is scarring. Let's talk a little bit more about septoplasty and specifically the consequences on the septal mucosa. Most people don't think about this. They just sign up for septoplasty and don't understand that this will affect the status of the septal mucosa. Most often, but very often, the septal mucosa tears. And if we look on the right image here, we can see on the left side you have the cartilage wall, and on the right side here you have the mucosa and the perichondrium layer. So to be able to perform septoplasty, you need to remove the mucosa from the wall here. And when this happens, it's very easy that the mucosa will tear, and I'm going to tell you a little bit more about that later, the consequences. But if we look on the left image first here, we can see that the cartilage wall on this side, and then we can see that there are a small thin layer called the perichondrium here. And on the other side, on the left side here, we have the septal mucosa. And this is quite common, that the surgeon fails to remove the septal mucosa and the perichondrium together as one layer together. If he removes just the septal mucosa and leaves the perichondrium, or partly leaves the perichondrium somewhere, it's very easy that the mucosa will tear, because most strength is in the perichondrium layer. So without perichondrium, it's very easy that you will have a tear. And if the tear is in a horizontal level, is not good, but it's better than if it's in a vertical line, because many blood vessels they go from the back side in the nose to the front side, and if you tear the mucosa vertically from the top to the bottom to the nasal floor, you will destroy many more blood vessels, many more nerves and everything. So it's not good either way, but horizontal tear is less bad than a vertical one. Also, you can look on the right image again, and you can see the septal mucosa here is quite thick now. But after septoplasty, it's very common that this mucosa become paper thin. It's just, there's no thick blood vessels within anymore. There are only small capillaries, and yeah, the mucosa will become dry and numb. It can't swell up anymore together with the turbinates, so it will become just passive, inactive, and yeah, you will have problems. The nose will become open. Another thing that also can become destroyed is the septal swell body. I've been talking a little bit about that before, but the septal swell body is an area up here. Sometimes it's called the fourth turbinate of the nose. It's an area that have a lot of blood vessels, and they have a lot of goblet cells that produce mucus. It has a lot of thermoreceptor nerve endings, so it's important to sense the airflow. It's important for the immune system in the nose, and it's important to regulate the airflow to the upper part of the nose. And it does this in combination with the turbinates and the other parts of the septal wall, the septal mucosa. So when those parts swell up, the septal swell body also swell up, and vice versa. So a very common reason to have a septoplasty performed is if you have a septal spur. A septal spur, it's something that could be normal because many people have it, and it's a ridge between, you can see here that are 3 plates. So they crash together and form a ridge, more like similar to how a mountain range is shaped and designed. So yeah, and this ridge can go all the way back here to the middle turbinate. So if it goes all the way back here to the middle turbinate, that means that the surgeon need to remove the mucosa from the septal wall all the way back here. So there will be a really big area of the septal mucosa that will be affected from the septoplasty. And the bigger area, the more problem you can have, especially if the surgeon tears the mucosa. So if we look on the location of the septal swell body, we could see it here on an X-ray up here first. And I have made a circle here, so you can see on this image. So the septal spur is located here. So it's really close to the septal swell body here. So yeah, and you need to remove some extra cartilage, some extra septal mucosa here as well. You can't just remove it close to tight around the
the septal spur, you need to have some extra room to move around surgical instruments. Yeah, so in my case, the septal mucosa has become paper thin. My septal swell body is, it's more or less totally destroyed. I have explained this and I've showed images on this in this video here. You can see up to the left here. So if you want to know more about this, you can watch that video. If we look on the right image here, we can see the septal mucosa to the right here. First, it should be shaped in an arc like this, and it's not longer shaped like that because surgeon probably removed cartilage up here, and you can see where the septal spur was located before, because it's kind of like a trench here now. And you can see some probably old parts in here from the septal spur, and the mucosa is so thin now so that those parts almost perforate the mucosa. So in my case, this mucosa here is passive, it's inactive, it doesn't have any bigger blood vessels anymore, it can't swell up anymore. So the nose is just extremely open all the time, it's dry, I have no airflow sensation here, so he probably has also teared some nerves. And if we look on this image, this is my x-ray before the surgery. You can see here was my septal spur, and here is the location of the septal swell body. So you can see how close it is to the septal swell body. So of course this area will be affected. And this image to the left here, you can see before the surgery how thick the septal mucosa was, and this is after. It has become extremely thin. And this image also shows a little bit here that part is shaved. So yeah, this is something you need to understand also before deciding about having a septoplasty or not. So some other complications that the doctor won't mention to you. In my case, the appearance of my nose changed for the worse. So you can have asymmetry of your nose, bumpiness. You can have a narrower nose, at least in the middle part of the nose. You can have a valve collapse. I have a small valve collapse. I'm going to show you images on that later. You can have a septal perforation. I've been telling you about this before here. It could be directly from the surgery if the surgeon removes too much cartilage, or it could be afterwards if he tears the mucosa on both sides in left and right nostril. If he performs septoplasty in left nostril and in the right nostril, and if he tears the mucosa on both sides, the cartilage structure will not get nutritions anymore. So in time it will die, and a hole will be created, and that hole could be extremely large. And there's nothing really you can do about a large hole. Small holes you can fix maybe, but anyway the mucosa will become thin, numb, and non-functional. And the septal swell body, I told you about that before. So I leave for you to read the rest yourself here. If we go for the next, this is my images here, so you can see this is how my nose looked before the surgery. It's quite even shaped here, and this is how it looks after. And in my case, it wasn't too bad. I have seen people who have become extremely much more damaged by the surgery. So I have a small valve collapse here. My nose has become more narrow here as well. It's not as wide as before. So
yeah, this is also something you need to understand, something that the doctors won't tell you. I'm now going to show you the techniques the surgeons use to convince people to have a totally unnecessary nasal surgery. So if we look at the first one, they often claim that if you go there, the first thing they will have you to do is to have an X-ray performed. And when you get the result back from the X-ray, in many cases they would say to you that you have a deviated septum and that you need to perform surgery to have a better breathing. The problem is that they don't tell you that 70 to 80% of all people in the world have a more or less deviated septum. It's normal. And in most cases, if you are grown up with the deviation in the septum, it's not the reason for the nasal congestion, because the turbinates and the mucosa in the nose, it adopts its size and shape after how the nose is designed. So if we look on the left side here, for example, here's a person who have a completely straight septum. So you can see that the turbinates on each side here, the inferior turbinates, are pretty much the same size. You can see the black area here, it's where the air can pass. So you can see that there are air can pass in both nostrils here. Quite similar amount, I would say. If we go to the right side here, the middle image, we can see that this is the person who have a deviated septum. It's on the convex side here. You can see that the inferior turbinate has become smaller. And on the concave side, you can see that the turbinate has become bigger. And if we look at the black area, then the open area where the air can pass here, we have quite a lot in this nostril, and we have quite a lot in this nostril. So this person will get plenty of air. If you go to the other side here, here's a person that have a deviated septum to the other side, to the right side. So if we look on the convex side, it's a smaller turbinate again, and on the concave side is a bigger turbinate. And you can see the black part where the air can pass. It's quite similar to in both nostrils. So they don't tell you this. So it's a lie that most people, they don't need to have a septoplasty. There are other reasons for having nasal congestions, like inflammation, autoimmune conditions, allergies, food intolerances, histamine intolerance, mold, dry, dusty air, etc. So it's all about reducing the inflammation in the body. You shouldn't have a septoplasty performed, but they use this like an instrument to convince people to have surgery. Let's talk about lie number 2. If they can't find a deviated septum on you, they can anyway use another method to try to convince you to have a surgery to your turbinates. And it starts in the same way. They send you on an X-ray. If they can't find a deviated septum, they tell you that you have a hypertrophic or enlarged turbinate. But what they don't tell you is that turbinates are an organ that change in size from time to time. So it can grow, it can shrink, it can grow several times its original size. So you can't really do an X-ray taking a moment in time, a half a second, and tell if the nose is congested, if it has too little open volume or not, because you need to take several images to see how the nasal cycle reacts. And they know this, but they use this to convince you to have a surgery. So first they will show you an image saying, okay, we have found here, if you look on this image here now, we have found that your right turbinates is too large. You need to reduce that. That's the reason why you have nasal congestion. And if you look on it like a patient, if you don't know about the nasal cycle, it sounds reasonable. Sounds like, oh, okay, I understand that must be the reason for my nasal congestion, and then you sign up for the surgery. But if you look on another image here of the same person, if you look like this could be maybe an hour later or maybe 4 hours later. If you look now, can you clearly see here that the other turbinate is enlarged, and the turbinate that was too big the last time is now smaller. You have a extremely good airflow in that nostril. So yeah, this method is yeah, what to say, yeah, they used it to convince people, and they don't tell about how the nasal cycle works. In Sweden, and I think also in Europe, in many cases, there are healthcare system that is financed by the government. So the surgeon and the doctor should have a little bit less interest in making money from the patients, but it's not true in all the cases, because at least here in Sweden, it's common nowadays that surgeons start their own companies and sell their company's services to the hospital instead of being directly employed by the hospital. So if they have money interest in the surgery, of course they will be less likely to do a smaller surgery and to tell you the truth about the complications and the risks. In my case, for example, the surgeon who did my surgery, he has his own company named Arnbrandt and Rudbergs AB. So yeah, he probably had some interest in making money off my surgery. Let's switch side here and talk a little bit about the systemic effects of nasal surgery. I've been talking about that before in this video here. So if you want to learn more about that, you can follow that link. In that video, I'm talking about the limbic system, how sleep is affected, how cognition is affected, and yeah, you can also see some scientific studies about empty nose syndrome and the breathing. So in this part here, I'm just going to talk about one thing I forgot, and that's the oxygenation of the body. So a thing that often happens after nasal surgery, if you have your turbinates removed or your septal mucosa destroyed, is that the nostril will be extremely open, so there will be no natural air resistance. And this, together with the lack of airfeel, if the mucosa gets destroyed, the thermoreceptors get destroyed, there will be no, or at least much less airfeel sensation in the nose. This triggers a feeling of air hunger, suffocation, and your respiratory rate is increased, so you breathe faster and more shallow. This is very clear in my case because I have one functional nostril, the left one, and one totally destroyed one, the right nostril. So if I breathe through the left one, I breathe slowly, deeply, I feel relaxed. And when the breathing shuts down in that nostril and goes over to the right nostril, yeah, the breathing pace goes up, respiratory rate becomes faster, and I feel totally unrelaxed. If this happens at night, I always wake up gasping for air,
and I most of the time also have pain, a dull pain in my lower arms and in my lower legs, and for years I thought it was restless legs syndrome. But now, when I've been researching this, I found out the real reason. And if I look on my arms when I wake up, first when I wake up, I have really fast breathing, not so deep. So that's the first thing, and I feel unrelaxed with my breathing. So when I look at my underarms, when I have the pain, I can see that blood vessels that normally bulging out on my lower arms are now caved in. It's not easy to see on this image here really, but if you compare both images, the one to the right with the one to the left, you can see there's more, looks a little bit like a ditch, and I can clearly see it with my own eyes, and if I sense it with my fingertips, I can clearly sense that they are caved in. So this means that I have vasoconstriction. So here's the science I found behind extensive breathing. So if you breathe too fast, too shallow, this leads to a low concentration of carbon dioxide in the blood. And a low level of carbon dioxide in the blood makes the blood more alkaline, and this in the next step causes vasoconstriction. So it tightens the blood vessels, and it causes less blood to reach the brain, to reach the organs. Yeah, less blood to reach the entire body. So there will be less oxygen, less nutrition that comes out in the body, and on top of that, hemoglobin, the protein in the red blood cells that transport oxygen molecules, it does this in the presence of carbon dioxide. So if a person have low concentration of carbon dioxide in the blood, the hemoglobin has more troubling to release oxygen in the body. So this works in two ways. It contracts the blood vessels, which I can see on my lower arms as well, and also the hemoglobin can't deliver the oxygen molecules to the body. So yeah, we get a light variant of hypoxia, which means that we get too little oxygen in the body. And yeah, if this happens one day, it shouldn't be that bad. But after surgery in the nose, this could be your life. So it could be like for every day for the rest of your life. So of course it's going to affect your health badly in the long term. The information I found here is from a podcast with the breathing expert Patrick McCoven. So you can see some comments on the right side here. You can read that yourself, just to read up a few things that, the faster we breathe, the more the blood vessels constrict. The body saves 42% of water if you breathe through your nose. Nasal breathing increases oxygen uptake by about 10%. And slow breathing, 5.5 to 6 breaths per minute, activates the rest and digest system. So it's important to have a slow respiratory rate. Let's skip side here and go for another subject. This is a study about the production and absorption of nitric oxide gas in the nose. Some people know this gas is produced in the sinuses, but it's also produced in the nasal mucosa. So in average, they found out in the study that 352 nanoliters per minute is produced in the nasal mucosa and in the sinus mucosa. But they haven't been able to measure the other forms of nitric oxide that is taken up directly by the nasal mucosa. So some parts is transferred into some other kind of chemical combined forms. It's not in a gas form, but it's in another form, and that part is taken up directly by the capillaries in the mucosa.
So when we look at the number 352 nanoliters per minute, it's probably way more than that reaches the body. So if you destroy your turbinates or your other nasal mucosa, either directly from surgery or secondary to dryness and infection years after the surgery, yeah, you will have a smaller volume of nitric oxide produced inside nose. And there will also be less area of the mucosa in the nose that can absorb the other chemically combined forms of nitric oxide. This means that you will have vasoconstriction all over your body, more or less, and yeah, it decreases the delivery of nutrition to the cells in the body. It decreases also the oxygenation of the body. So my problem when I wake up at night with dull pain in my lower legs and arms, and at the same time having vasoconstriction of the blood vessels, this is probably related to me having a too low nitric oxide level being produced in my nose, especially in my right bad destroyed nostril, and also a combination with my breathing being too fast in the right nostril. So if I use decongestion spray in my left good nostril and that one opens up, I breathe, I lie still in the bed, breathe for just 15 minutes, and after that I can see that my blood vessels in the lower arms, they open up again and the pain also disappears. So for sure it's definitely related to my nose surgery, and when I breathe through the left good nostril, I don't really have that problem. So this is something that probably affects many people with empty nose syndrome, many people who had destruction of the turbinates of the nasal mucosa. So I don't know how many who have this specific problem, but for sure many people will have a more rapid breathing, less nitric oxide produced in the nose, and they will have just a tiny bit of hypoxia like every day. So in the long term, of course, it's not good at all. Lastly, I'm going to show you this study. Inhalation of nasally derived nitric oxide modulates pulmonary function in humans. So this was a study where they had two groups, a healthy control group and a group with intubated patients who were hospitalized and who were breathing through a tube in the mouth. So the aim of the study was that they wanted to see if nasal breathing would improve oxygen levels in the body. So they connected the breathing equipment also through the nose somehow in the sick group. And they could see that oxygenation level in the body improved by amazingly 18%. And in the healthy control group, if they compared that group breathing through the nose or breathing only through the mouth, they could see that breathing through the nose improved the oxygenation level in the body with 10%. So the conclusion they made is that nitric oxide, it is a vasodilator. It opens up the blood vessels, it improves blood flow in the body, and it also improves oxygenation. 18% in the sick group and 10% in the healthy group.
Dr. Song, hello Jay, hello G&G. Here I'm in Germany in a hospital. They will try to make me better, but it's still not, maybe not possible, I don't know. It's flip a coin, and yeah, I suffered day by day, cause your surgery, Dr. Song. You make 2 holes in my nose, and now you can put a train inside or a truck, and I cannot sleep. I feel energyless and hopeless, and I ask myself all the time why I come to Korea to G&G. Have a nice day.